Hi, my name is Chloe McHale, and I chose to present on personal psychotherapy for adult populations. I chose this topic because I don't have any experience using interpersonal psychotherapy, so why not get to know it better? Interpersonal psychotherapy is a time-limited, structured talk therapy originally developed for major depressive disorder, which emphasizes the role of interpersonal relationships and life events in influencing mood, according to the Cleveland Clinic. A client and therapist work together to identify a current interpersonal problem area and explore how an individual's relationships affect their mood and vice versa, rather than deeper problematic experiences of the client. Interpersonal psychotherapy offers a relevant intervention approach when an individual experiences a clear interpersonal issue or change, including a role change, loss of a relationship, persistent conflict in a relationship, or social isolation. In addition to providing focus on how a client relates to others, how others relate to the client, and how those relationships connect with the client's emotional state, according to Cleveland Clinic. Interpersonal psychotherapy utilizes a medical model of illness and links depressive mood to 4 research-informed interpersonal problem constructs: complicated grief, role transitions, role disputes, and interpersonal deficits/sensitivity. Interpersonal psychotherapy may be helpful in several ways, specifically effective for adults experiencing depression, of whose relational issues are influential to their mood or functioning. By providing focus on interpersonal problems, it maintains a clear starting point for therapy, rather than creating diffusion with a client's other complex issues. Interpersonal psychotherapy helps clients to understand and reconstruct their interpersonal dynamics, communication patterns, social expectations, and emotional responses that contribute to their distress. Interpersonal psychotherapy links mood symptoms to relational and social constructs, reinforcing a wider view of depression that's not solely manifested from inside the individual, providing aid to increase the client's insight surrounding their relational issues. As interpersonal psychotherapy is structured and time-limited, it can appeal to clients who prefer therapy with a clear endpoint and practical focus. Empirical evidence displaying that interpersonal psychotherapy has demonstrated resilience for late-life depression in adult populations, according to Yu et al. Interpersonal psychotherapy is typically utilized in a structured sequence. Treatment often lasts 12 to 16 sessions and begins with identifying a specific interpersonal problem area contributing to the client's symptoms, according to Cleveland Clinic. Initial phase involves assessing the client's current symptoms, relational history, and identifying the interpersonal context of the distress. Then the intervention plan is agreed upon, determining the number of sessions, goals, structure, and what will happen in therapy. Middle phase involves implementation of techniques ranging from clarifying feelings, analyzing patterns of communication, practicing new interpersonal behaviors, role-playing, and linking mood changes to interpersonal events, which are determined based on the client's individual needs and cultural context. Final phase includes reviewing progress with a client and establish client's plan to maintain improvements beyond therapy. Throughout therapy, therapists taking an adaptable approach of interpersonal psychotherapy in response to different cultural contexts, interpersonal themes to a client's family dynamics, cultural norms, and community support should determine the intervention plan's goals, according to Yu et al. Some pros of interpersonal psychotherapy include the evidence-based approach for treating depression across populations, according to Yu et al. Therapy is time-limited and structured, making it accessible, goal-oriented, and achievable, according to the Cleveland Clinic. Therapy is culturally adaptable, allowing therapists to modify interpersonal themes to fit the client's social and cultural context, according to Yu et al. Lastly, identifies interpersonal triggers that directly targets problem areas, making treatment effective when considering the client's mood within these experiences. Some cons of interpersonal psychotherapy include the narrow focus may overlook deeper emotional or trauma-related issues while not addressing trauma histories or unconscious conflicts that require deeper exploration. Therapy may be challenging for clients with difficulty identifying emotions and interpersonal patterns. Therapy requires active participation. Clients must be willing to discuss relationships dynamics freely for therapy to be helpful. Lastly, requires therapist expertise in the interpersonal psychotherapy model. Successful implementation depends on adequate training that can affect the quality of care, according to Yu et al. Here are the references I used for my presentation, and I hope you enjoyed. Thank you.